LSD, or lysergic acid diethylamide, is thought to be an extensively researched hallucinogenic drug. It's extremely potent, illegal, and better known as acid. Its effects have been described on a wide spectrum, from stimulating to mind-altering to bad trips and paranoia. Some people say it was life-changing for them, while others don't notice any long-term impact. Lysergic acid diethylamide, or LSD, belongs to a class of drugs known as hallucinogens. It's a clear, white, odorless material, and it has many other street names, including acid, blotters, dots, and yellow sunshine, for example. LSD was first made by Albert Hofmann in Switzerland in 1938 from ergotamine, a chemical from the fungus ergot that grows on rye and other grains. The psychoactive effects of LSD were discovered in 1943, and it was introduced as a drug for research purposes under the trade name Lsd in 1947. Possession of LSD was made illegal in the United States in 1968. According to the National Survey on Drug Use and Health, more than 22 million people, or 9% of the population, have used LSD at least once in their life. Most people use LSD for recreation and social reasons. Some people say they take it for spiritual reasons, hoping that an LSD trip will provide them with new insights about their life. However, the effects of LSD are highly unpredictable and can be a terrifying experience for certain people. A bad trip is sometimes described as a living hell. Some researchers think that while the drug is widely abused, it doesn't appear to be addictive. This is likely because many people avoid it after having a bad or unpredictable trip. A research paper from 1968 states that tolerance to LSD develops rapidly in humans but is easily lost. Back then, they described withdrawal symptoms, including slight restlessness and irritability, as being absent or mild. Recent research points to hallucinogen persisting perception disorder, or HPPD, which is when hallucinogenic effects, distorted perception, and flashbacks persist long after the trip is over. Although rare, HPPD is hard to treat and can lead to lifelong disability due to mental health disturbances. People say LSD intoxication may cause increased sensory perception and mental imagery, illusionary changes of perceived objects, synesthesia to taste sounds, smell colours, and see scents. They mention how emotions are intensified, thoughts accelerated, and their scope usually broadened, including new associations and modified interpretation and meaning of relationships and objects. Another aspect users mention is a weakening of ego identification. Various authors have compared the psychedelic state of consciousness to a daydream, but one that can quickly turn into a nightmare. See The Doors of Perception, Heaven and Hell from Aldous Huxley. Recently, researchers have been investigating the effects of LSD and other psychedelics for end-of-life anxiety, post-traumatic stress disorder, cancer, and addiction treatment. Albert Hofmann first synthesized LSD in 1938. Allegedly, the main intention of the synthesis was to obtain a respiratory and circulatory stimulant. It was set aside for 5 years until 1943, when Hofmann decided to re-examine it. He said that while resynthesizing LSD, he accidentally absorbed a small quantity through his fingertips and thus discovered its effects. He described what he felt as being affected by a remarkable restlessness, combined with a slight dizziness. At home, I lay down and sank into a not unpleasant, intoxicated-like condition, characterized by an extremely stimulated imagination. In a dreamlike state, with eyes closed, I found the daylight to be unpleasantly glaring. I perceived an uninterrupted stream of fantastic pictures, extraordinary shapes with an intense kaleidoscopic play of colours. After some 2 hours, this condition faded away. 3 days later, Hoffman performed a self-experiment to determine the effects of LSD, intentionally ingesting 250 micrograms of the substance, an amount he predicted to be a threshold dose. An actual threshold dose is 20 micrograms. Less than an hour after, Hoffman experienced sudden and intense changes in perception. He asked his lab assistant to escort him home, as the use of motor vehicles was prohibited because of wartime restrictions. They had to make the journey on a bicycle. On the way, Hoffman's condition rapidly deteriorated, as he struggled with feelings of anxiety, alternating in his belief that the next-door neighbour was a malevolent witch, that he was going insane, and that the LSD had poisoned him. When the house doctor arrived, however, he couldn't detect any physical abnormalities, apart from a pair of incredibly dilated pupils. Hoffman was reassured, and soon his terror began to give way to a sense of good fortune and enjoyment, as he later wrote. Little by little, I could begin to enjoy the unprecedented colours and play of shapes that persisted behind my closed eyes. Kaleidoscopic, fantastic images surging in on me, alternating, variegated opening and then closing themselves in circles and spirals, exploding in coloured fountains, rearranging and hybridizing themselves in a constant flux. Hoffman considered that LSD may have valuable psychiatric use because of its intense and introspective nature. He couldn't imagine anyone using it recreationally. He later summarized his thoughts about psychedelics, including LSD and psilocybin, in the book LSD, My Problem Child. Studies suggest that LSD is an activator of serotonin receptors in the locus coeruleus, the RAF nuclei, and the cortex. The hallucinogenic effect of LSD has been linked to its affinity for the serotonin receptor. According to some research, LSD at high doses decreases the dopaminergic neural activity in the ventral tegmental area, the main source of dopaminergic neurons in the brain, implicated in the pathogenesis of psychosis. LSD-assisted psychotherapy reduced anxiety associated with life-threatening disease in one recent study of 12 advanced-stage cancer patients in a medically supervised, safe environment. Treatment included drug-free psychotherapy sessions and 2 LSD-assisted psychotherapy sessions 2 to 3 weeks apart. At the 2-month follow-up, anxiety was significantly reduced. No acute or chronic adverse effects persisted beyond the first day after the treatment, or treatment-related serious adverse events. Anxiety reduction was sustained for 12 months. However, this study included only 12 people, so no solid conclusion could be drawn from it. Studies in the 60s suggest that LSD might help to reduce pain and improve sleep in cancer patients. However, these studies all suffer from methodological flaws and small sample size. None of their findings have been verified. One research group recently postulated that LSD might reduce psychological pain in the terminally ill by breaking the cycle of anticipating pain and helping people cope with the fear of death. In a recent placebo-controlled study, healthy volunteers who were administered intravenous LSD between 40 and 80 micrograms gave a significantly higher rating for the creative imagination scale. These results suggest that LSD enhanced the influence of suggestion, which may have implications in psychotherapy. The authors of the study found that suggestions must be of sufficient duration and level of detail to be enhanced by the drug. Individuals with high trait conscientiousness were especially sensitive to the susceptibility-enhancing effects of LSD. In a 2016 placebo-controlled, double-blind, random order crossover study, 100 micrograms of LSD in 24 subjects and 200 micrograms LSD in 16 subjects produced feelings of happiness, trust, and closeness to others. It enhanced explicit and implicit emotional empathy. Scientists hypothesize that LSD acutely impaired fear recognition and enhanced emotional empathy and sociability. However, no other recent study looked into the effects of LSD on suggestibility, sociability, or empathy. In one study from the 60s involving 24 healthy participants, suggestibility was significantly enhanced by LSD and mescaline. In another, similarly limiting study, LSD improved suggestibility in hospitalized patients with neurosis and schizophrenia, but less so in patients with depression. The use of hallucinogens like LSD for addiction is highly controversial. The risks of such practices are high and clinical data is sparse. A meta-analysis of controlled trials suggests that hallucinogens and high-dose LSD should be further studied in the treatment of addictions, since they show some potential. According to a 2012 quantitative meta-analysis of 536 participants and 6 trials, LSD may have some positive effects. However, large-scale controlled trials are lacking. One study reviewed the use of LSD in the treatment of drug dependencies, and the authors considered that it might help in the recovery of drug dependency, possibly involving a serotonin mechanism. Surveys indicate that hallucinogens have been increasingly used by cluster headache patients outside of a physician's recommendation, mainly to abort a cluster period. The use of hallucinogens for headaches is controversial, and only sporadic reports mention it. No proper clinical trials have been conducted. According to a group of researchers who interviewed 53 cluster headache patients, 7 of 8 LSD users reported cluster period termination, and 4 out of 5 users reported extension of the time with no symptoms. According to one study, the recent behavioral and neuroimaging data suggests that psychedelics like LSD may modulate neural circuits that have been implicated in mood disorders. Some scientists believe that they hold the potential for reducing the clinical symptoms of these disorders, but clinical studies are lacking. Researchers were interested in LSD's potential mechanisms. In animal models, LSD affected serotonin in the brain, a rebalance of the hippocampal 5-HT2A to 5-HT1A signaling also. The only available findings on LSD's effects on creativity are based on anecdotal experiments that were carried out in the 60s. Although interesting to some, no valid conclusions could be drawn from these experiments. It was extremely easy to study LSD and other psychedelics back then, and researchers didn't need any sort of approval. One such scientist that gave LSD to artists at the time claimed to have documented the process was Oscar Yanager, a Californian-based psychiatrist. In one study, Yanager gave LSD to a mixed group of 60 visual artists over a 7-year period. He said the artists produced over 250 drawings that were demonstrated to be improved by the LSD. Aspects of the artist's work that counted as improved were highly subjective descriptions like more expressionism, sharpening colour, greater freedom from prescribed mental sets, increased syntactical organisation, deeper accessibility of past impressions, and a heightened sense of emotional excitement. In another study from the 50s, a group of researchers claimed that LSD improved the work of graphic artists. In a 1966 pilot study in a group of individuals engaged in various industries like engineers, theoretical mathematicians, physicists, architects, and designers, the authors said LSD improved creativity. In a 1967 experiment conducted on 19 graduate students, creativity data was allegedly also improved by LSD. Some researchers issued reports on the use of LSD in the treatment of children with autism, mostly between 1959 and 1974. Several positive outcomes were reported with its use, but most of the studies lacked proper experimental controls and presented largely experimental narrative data. The several studies which were based on the modification of autistic behavior with LSD-25 and also the treatment of autistic schizophrenic children with LSD-25 and UML-491. Researchers want to determine if LSD, as an activator of a serotonin receptor, blocks inflammatory effects of tumor necrosis factor alpha, induced expression of pro-inflammatory cell adhesion molecules, cytokines and chemokine genes, and expression of VCAM1 protein. They are carrying out research in cells and animals on this. Some scientists are also investigating its effects on the production of interleukin-6 in cells. A study by researchers from the University of Alabama at Brigham and Johns Hopkins University School of Medicine collected data on 25,622 individuals under community correction supervision in treatment accountability for safer communities, and they found that hallucinogen use predicted a reduced likelihood to fail the TASC program. The results suggest that hallucinogens may promote alcohol and other drug abstinence and pro-social behavior in a population with high rates of recidivism or high rates of repeat addictive behavior. Another controversial experiment, the Concord Prison Experiment, dates back to the 60s, led by famous psychedelic advocate Timothy Leary. Leary claimed that compared to the average recidivism rate of 60% for American prisoners in general, the recidivism rate for those involved in his project dropped to 20%. He believed that a combination of psilocybin and group psychotherapy should be used in prisons. Some researchers think, just like psilocybin and peyote, LSD may increase beta brainwaves, which are associated with alertness and awareness, and LSD increases the variability of brainwaves. Limited data from the 60s suggests that chronic LSD users, example 15 to 300 total doses, have an increase in energy for all brainwaves accompanied by a faster reaction time. In one small anecdotal study, 22 mental health professionals who self-experimented with LSD were interviewed. They didn't report long-term negative effects, but it's impossible to draw valid data from this experiment. Case reports of long-term psychiatric problems attributed to LSD include psychosis, panic attacks, other anxiety disorders, and depression. Animals given LSD long-term developed symptoms of schizophrenia. A side effect associated with the use of LSD is partial or total recurrence of perceptual disturbances, which previously appeared during the intoxication, despite the absence of recent use. These are commonly referred to as flashbacks, or hallucinogen persisting perception disorder, or HPPD. 2 case reports of patients with a prior history of LSD turned to psychiatric consultations following episodes of HPPD. Another report describes the use of LSD among alcoholism treatment facility inpatients and a degree of subjective distress experienced during these flashbacks. LSD may cause a loss of appetite, sleeplessness, pupil dilation, dry mouth, salivation, flushing of the face, excess sweating, nausea, and inner trembling. LSD also causes increased body temperature, heartbeat, blood pressure, and blood sugar. LSD produces intense effects in extremely small quantities. The minimal recognizable dose of LSD in humans is about 25 micrograms. Clinical trials considered a dose for a typical LSD reaction to be in the range of 100 to 200 micrograms. LSD is generally taken orally. After ingestion, LSD is completely absorbed in the gut. After 100 to 250 micrograms of LSD, psychological and physical effects peak after 1.5 to 2.5 hours, although the effects are felt for hours after. The effects of LSD usually last up to 8 hours. A 2017 review of 2 clinical studies found that a 100 microgram dose, there was a maximum blood concentration of 1.3 nanograms per mil, and the time to reach the maximum blood concentration was 1.4 hours. It had a half-life of 2.6 hours, a subjective effect duration of roughly 8.2 hours, plus or minus 2.1 hours, and a subjective peak of effects was 2.8 hours long. At a 200 microgram dose, the average maximum blood concentration was 3.1 nanograms per milliliter. The time to reach the maximum blood concentration was 1.5 hours. The half-life was 2.6 hours. The subjective effect duration was 11.6 hours, plus or minus 1.7 hours. And the subjective peak effect lasted for 2.5 hours. So in summary, after oral administration of LSD, it takes around 1.5 hours to reach the maximum concentration in the body. 2.5 hours to produce effects, and then the effects can last anywhere from 8.2 to 11.6 hours depending on the dose. Information: see my videos on microdosing, my video on mescaline, and my video on psilocybin or magic mushrooms.